Well, addiction actually, it's multifaceted because we have the assault, we have the domestic violence, we have people that fall down and hurt themselves because they're intoxicated. We have the overdoses. So we see quite a bit of addiction-related problems. It's not just overdose. It's child abuse. It's elder abuse because they can't care for the others. They're too busy being incapacitated. We see malnourishment because they don't care for themselves. They can't eat and drink appropriately. They form diabetes, they form heart disease, they have liver problems. So a lot of things do come from addiction.
And you've just heard from Shauna Staton of the Powell County EMS, and she is the guest on this week's episode of The Local Lens, the podcast from the Powell County Health Department and Kentucky Rio, where we go inside our community's experience with the drug epidemic. So here at The Local Lens, we believe that every person sees addiction from their own unique perspectives, and our show wants to showcase those perspectives. And this one is a very special episode to us because we have somebody from the Powell County EMS team where most of the calls, as you've just heard, have something to do with addiction. Well, let's go on and get into this episode. Let us know online if you're listening. Reach out to us on Facebook, find us on there, and let us know what you think. Anyways, thank you for tuning in. We are glad that you are here. I'm your host, Nate Brooks. This is The Local Lens. These are our people, using our voices, telling our stories, because no one sees it like we do.
I'm Shauna Staton. I'm here local. I've been a firefighter for 18 years and EMS for 15. I work on the front lines here in the county and in the community. I've been here since 2006 working on the streets, and I also dispatch. I've been doing that for about a year and a half here in the county. So I've worked here as well as Menifee, Bath, Wolf, Breathitt, Louisville, Kentucky, and Indianapolis, Indiana. So I've kind of have a broad reach and have seen many, many different areas.
What is the biggest difference between these smaller towns that you're from and like Louisville and Indianapolis?
The crime is different. Up there, it's more gang related and violent crimes. Here it's more theft and drug related. But there in the metro areas, there's a lot more things to do, and unfortunately there's a great divide within ethnic populations of what's available to who. There's a great disparity there. Here we're all kind of the same and we all have the same problems.
And that makes the problems louder,
yes,
I would imagine, because
yes,
it's more like an echo chamber.
Absolutely.
So, yeah.
It's a generational problem. How do we get out of this?
Yeah. Well, let's ask that up front then. How do you think we get out of this if you've got the solution?
We have to start young. In our schools, we need to start teaching to get to the root of the issue, and most of the root of the issue is mental health. We have to take that stigma away that there's a defect. It's not a defect. It's a health problem. If you have diabetes or a heart condition, you're going to treat that. The same needs to happen with mental health. These are real issues, real diagnoses. These exist. They are problems. They're treatable. We just have to take away the stigma.
So is this how you've always approached addiction?
Absolutely not.
Absolutely not,
No.
You said. What changed?
When I entered the field in 2006, mental health was still not in the forefront. People in our field who experience PTSD and depression and anxiety, we were told you're soft, get out of the field. You can't handle this. Instead of treating the root of the problem. So now we take pride in, hey, what medication are you on? Let's compare. What do you take now?
Yeah.
And, hey, what are your diagnoses? Who do you see? We seek treatment for it. And it's no longer a secret. I mean, it's out there. People in our field commit suicide at a much higher rate than the general population. It runs rampant in us. Addiction affects our field as well. I know lots of great providers that have fallen into addiction because they're trying to treat pain that exists, whether it be physical because we break down our bodies, or whether it be mental because we see the worst of the worst. And what we have to realize is everybody's human. We all experience the same things in the same ways. Just some people are taught coping mechanisms and a lot of people aren't. Therefore, we need to start, as in the elementary schools even, we have to explain this early and educate people the signs to look for.
Yeah.
So it doesn't become a bigger problem.
So you said that, like, that landscape has kind of changed within your field.
Yes.
We've spoken to some other EMS people, like the Estill County directors on our show before, and that's a bit of a different role than what you're at. You are one of the EMS workers, right?
Yes. Yes, I'm an EMT. I work the ambulance every third day.
Okay. How long has it been that, like, you've kind of seen this shift towards, like, an appreciation for the mental health side?
In the last 5 years, definitely.
Really?
Yes.
Okay.
This is very new.
Is it like a social media thing? Did COVID have anything to do with it?
No, COVID had nothing to do with it. In fact, it actually made it worse.
Dang.
Yeah.
It made everything worse, didn't
it? It did.
Gosh.
It really did. It affected us greatly. And we're beaten down. We're tired. We're exhausted from COVID. And becoming complacent in the field. Compassion fatigue is really setting in. However, I think that actually makes us identify more with people, lay people in addiction. I think it gives us a better understanding that, people are just tired. And to combat that exhaustion, and I mean mental exhaustion of, fighting demons in your head, you have to do something.
When you're talking about having compassion fatigue, then how does that sit with you as a worker, knowing that that's happening to you?
I think it's time to get out of the field. When you no longer care about your patients, it's time to leave. You're not there for the right reasons.
You've been there for 15 years.
15 years, and our career expectancy is only 5.
Yeah.
So I've been here 3 times more than most people. And for that to set in, we all go through burnout. It happens. You go to the same people every day for the same problems. They refuse to take care of themselves. They're not compliant with their medications. They want somebody to take care of them. When it all boils down to, we all want somebody to care for us. That's all it is. We just want somebody in this world to care. And a lot of times it falls to us. People don't have family, or they feel like nobody cares about them. And with COVID, we're so isolated right now. So people don't come around each other. There aren't these social functions. And it all falls to us because we're always available. So we shoulder a lot of the social work in the county.
I'm glad that Shauna brought up social work, because back in 2020, we were hearing a lot of people calling for there to be mental health workers and social workers involved in the first responders. How do you feel about that? What are your thoughts?
I think it's a definite need in the county. I actually spoke to one of our other dispatchers recently about doing some mental health training, cross-training with our law enforcement, because people are ending up in jail when they have schizophrenia, or they don't know what else to do with them. jail is not where they need to be. They can't receive their medications there. They're not receiving counseling there. They're not receiving anything. They're thrown in a cell and just told to exist. And we can't be doing that. People are human. They don't deserve that. They need proper treatment. We need access. Eastern Kentucky is severely underserved as far as healthcare in general. There aren't primary care physicians. There aren't mental health professionals. You get a person once a week in a clinic, and that's unacceptable. In bigger cities, they're on, every 3 blocks. They're widely acceptable. You do a Google search and you have pages. Here you go, well, there's one in this county, there's 2 counties over, and they're all the same network. And it's been our experience here in Eastern Kentucky that a lot of them are religious based. I'm not knocking religion, but that doesn't fix the problem. Not everybody can see faith-based. Not everybody is rooted in faith and religion, and it doesn't work for everybody.
Now, a lot of people do say that religion played a big role in their own recoveries, but she's right. It doesn't work for everybody. There are some people that religion is not going to reach. And a lot of our treatment programs being religion-focused may be explained by us being in the Bible Belt here, but still, we have to find other avenues to reach people. Now, another problem that we have locally is you look at how small the counties are and how there's a lack of a lot of things in our region, and it becomes an issue of how on earth do you even get mental health workers out here when you also have the same issue with physical health as well in a lot of areas. So let's hit on that actually real quick. So Powell County does not have a hospital.
No.
Lee County, I don't think. Nope. What are some of those solutions there? Does that just, you guys have to do a lot of driving?
We do a lot of driving. Our transport time is about 35 minutes anywhere we go. And, that makes us a stronger provider. But as far as accessing the specialties, it's very difficult. You have to go to Lexington to get neurology or to get interventional cardiology if you're having a heart attack. So we have a higher death rate from treatable illnesses because we live so far out. But that's a trade-off that we get for living in the peace in the country.
When you look at your whole bit of EMS work, how much of it is centered around addiction?
Well, addiction actually, it's multifaceted because we have the assault, we have the domestic violence, we have people that fall down and hurt themselves because they're intoxicated. We have the overdoses. So we see quite a bit of addiction-related problems. It's not just overdose. It's, child abuse. It's elder abuse because they can't care for the others. They're too busy being incapacitated. We see malnourishment because they don't care for themselves. They can't eat and drink appropriately. They form diabetes. They form heart disease. They have liver problems. So a lot of things do come from addiction. I would say 80% comes from neglect of self and others. So we see most of our issues come from not taking care of yourself.
So when that's most of your issues, then how many times does it happen that you are, or how often is it, I guess, that like you are responding to something that you know for sure, you're like, here's another like addiction related thing. Like,
we know where most of them happen. There are several addresses, several roads that we know 90% of the time what we're going to. We go to the same residences quite often. They're not always the same people. So we know the houses that have the drugs in them. We see them all the time. We see the same people on the streets. We have a huge homeless issue here.
We do.
A disproportionate homeless issue for the area. And that's happened recently. Within the past 3 years, we've had the influx. So we're not really sure where that came from or why.
So now we're about to take a turn into a segment about this tool called OD Maps, which does exactly what it sounds like. It maps out where overdoses are happening. You guys from the EMS, you know where the pockets have been for a long time. Now, with the OD mapping tool, you can tell other people who aren't EMS workers,
Right.
like, this is where things are happening. This is how this all works. We need to address this.
Yes. So a couple weeks ago, I went to a conference down in Corbin, and it was the Whitley County Health Department, Whitley and Knox, and the head of the health department came in and was talking about OD maps, and I'd never heard of it, and I was like, surely this has something to do with overdose. So she brought up this map of the United States, and there were all these different colors on it. And as we went through, they explained, this was an overdose, this received Narcan, this was alcohol related. And she showed us over 2 days how a certain batch came up I-75 and then branched out across 64 and then down the Parkway. And we got to watch it in real time over 2 days, how it branched out and how it changed from the different substances. So it's been used, I think in Montgomery County it was, the law enforcement actually put out a public service announcement that, hey, there's a bad batch in the area. People are dying from this. If you're using, please use with somebody. Use caution. And I think it's very important that that tool is out there and that our law enforcement was actually really compassionate about it. We all know that people are going to use. It's widely accepted. We know this. And we want people to use safely, because as long as they're alive, there's still a chance for recovery. If they're dead, you can't recover. So it's been a wonderful tool. It helps us to locate, where the overdoses are taking place, not necessarily where they obtained the substance. But as long as we can get in touch with those overdoses and make good connections with the people that live there and their neighbors, we can get Narcan into the area. Our first responders live throughout the county, and when we have an overdose, we'll call out our fire departments to first respond, because we have a long response time. In 8 minutes, you can be dead. We have more than 8-minute response time to a lot of areas in the county. So with being able to place Narcan within our communities in a more widespread area, we can save more lives. So it has really helped. It also helps us track specific dates and patterns around, like, when disability becomes available, when a new thing that we're seeing is right around the 15th of the month, when the child tax credit comes out. We're seeing a spike in overdoses on the 15th. Around the 1st of the month, we're seeing spikes. And some of them are just random. We don't know when they're coming or why. So we only have a very small snippet of data because we just started using it. But this will help us identify when these patterns are taking place and help us to increase patrols or increase our staffing on ambulances to anticipate these things and hopefully combat them.
This is an incredible tool, and I am so glad that we've started using it locally. So now we're going to spend a little bit of time responding to this long bit that she just gave. Mental health education is a very long-term solution for this. That is nearly as long a term as we could even try approaching. that is being approached, but it's going to be a long time before we see that.
Yes.
There have to be things that happen immediately that are Band-Aids.
Yes.
That absolutely are Band-Aids. Like some of the, like Narcan is one of those things, absolutely.
Yes.
OD mapping will hopefully help with like making Narcaning people easier. But like, what are some of the other things that you guys do with EMS that are Band-Aids on an issue?
We do encourage people when they do overdose to go to the hospital. We're doing more education at the scene. We'll stay and educate people. We leave Narcan behind sometimes. We'll train lay people right there how to use Narcan and leave it, because you can re-overdose. We see a lot of fentanyl right now. Fentanyl's half-life is longer than Narcan. So that stays in their system. They receive Narcan. They can re-overdose once we leave.
She's just mentioned how fentanyl has a longer half-life than Narcan does. And what this means is essentially Narcan is effective for about 1 hour, while fentanyl stays effective in your system for almost 8 hours.
So this epidemic, as far as fentanyl in our community, has brought about the need for a higher dose of Narcan. So the active ingredient Narcan is actually getting ready to come out in a new medication. It's being studied by the FDA right now, and it's an 8 milligram dose instead of the 2 or 4. It has a different name. I'll have to look that up for you.
Narcan Extreme.
Yeah, something like that.
It's actually called Cloxado, and I might be saying that completely wrong. And if I did, please forgive me.
But other things that we do, we leave behind resource packets. There are books that the health department provided us. We leave those. We encourage people to go to the health department to get Narcan. If we can't leave it behind, sometimes we run low.
Another reaction from earlier is that our response times are apparently very important, and to help get a better response time, we send out the fire department. The fire department is not the same thing as the EMS. So how is the fire department equipped to help here?
They're trained in Narcan. They can do Narcan administration. They can do CPR. Hands-only CPR is wonderful. We teach that in the community. Unfortunately, we haven't been able to do that because of COVID. We used to go to all the festivals and teach hands-only CPR, which has actually increased our survival rate of cardiac arrest. A lot of them are EMTs and do carry lots of different things with them. I think we have probably 6 EMTs that are in our fire departments that on our days off will go out and respond to things, because we live like in various corners. I live way out on the east and I'm the farthest east, so if we have something down on that end, then I'll go to that. But just helping to be farther out and greater access to healthcare. I mean, early intervention is key. Because if you're not breathing for 8 minutes, brain damage and death set in. I mean,
yeah, not breathing for 8 minutes. That's a long time to hold your breath.
Yeah.
Do you have any thoughts on the syringe exchange program?
I think it's great. It has decreased our hepatitis rate, and it has almost eliminated the HIV transmission in the area. So I think it's wonderful. We don't want to see people with pericarditis and, different infections. We don't want people sharing needles. We don't want people reusing needles. That creates abscesses and all kinds of more public health issues. We've seen a decrease in MRSA, which was heavily prevalent years ago.
Yes, I remember that. I was in middle school, I think, when MRSA was going around.
It was terrible.
Yeah.
So I believe that the syringe program is wonderful.
So when you look at the positives versus like what people say are negatives, was like them attracting people to come to the area.
Do it.
Yeah.
And they're going to do it. They're going to reuse. So why not provide them a safe way to use? And if it attracts people here, great, but let's find them the resources to help them. I think we definitely need some kind of housing and to help people get back into the workforce. There's a huge wall of homeless people being able to enter the workforce because they don't have an address. You have to have an address to get mail, to do an application. And people don't have access to clean water to go to an interview. It's just a huge cycle that they can't break. So we have to provide resources or help them get in touch with those resources. One thing I think is important to point out, in this time that we've had COVID, between February of last year to now, our overdose deaths are twice our COVID deaths in this community. And that's unique to our community. A lot of people are not this way. So this is definitely an epidemic here that's real in our community. And I think that's very important to point out.
I agree, because before COVID, things were actually like somewhat looking better.
Right.
That like it was, everything was lower in 2019, at least if I'm remembering right. I don't have the data in front of me, but like,
correct.
Yeah, everything was looking better in 2019 than it was in the years previous. And COVID really,
it has.
Yeah. The isolation that came from COVID, which I don't want to say that any COVID precautions have like caused more damage than good, because if we hadn't done the isolation stuff, but what it definitely does do is it sheds some light on what helps with addiction.
Absolutely. Social interaction, being active, having a purpose, having somewhere to get up and go to every day and be productive. I think that weighs heavily on people's minds. People want to do well. Nobody wakes up in the morning and says, I want to be an addict today, or I want to go do drugs today. This is just a survival technique. I believe that people actually want to do well. I don't think anybody wants that lifestyle. They just fall into it for many different reasons. I know people in the community that were very successful in their jobs, and because they lost them and they lost their families, and everything snowballed and they fell into addiction. There are many reasons why people get into it. We don't have the answers yet. The only thing that I know to do is start early and really push mental health education.
Well, that's all the time that we have today. Thank you all for tuning in. Once again, this was Shauna Staton from our EMS here in Powell County. She has such a wealth of experience. She has seen so much of this going on with her own eyes in front of her, and she's playing a huge role in how we respond to this and how we're going to move past this addiction and overdose problem. So I would like to thank Shauna once again for coming onto the show and sharing with us what she sees. I would also like to thank WSKV for broadcasting our show, and a big thanks to the Powell County Health Department and Kentucky Rio for sponsoring the show. We talked a lot today about long-term solutions and quick fixes, and we want to hear your thoughts. So please, we encourage you to find us on Facebook at The Local Lens and chip in. Tell us what you think about all of this. We want to hear y'all's responses. Well, thank you all for listening. I'm your host, Nate Brooks, and you've been tuned in to The Local Lens. These are our people using our voices, telling our stories, because no one sees it like we do.